It's an honor to represent the Pharmacy Shared Services, a team that plays a vital role in supporting 22 hospital pharmacies, ambulatory infusion centers, and a wide range of service lines. Dedicated to medication safety and exceptional patient care, clinical and leadership teams engage in consistent collaboration through regular meetings at local and system levels.
Formulary management is a complex process that aims to balance access to the most cost-effective medications for our patients while maintaining safety.
As part of our Pharmacy Shared Services team, I oversee most of our regulatory requirements, which includes being a very active part of our controlled substance diversion surveillance initiatives across the system. I also oversee the Sterile Compounding and Hazardous Drug Task Force, through which we've been able to standardize most of our training and education around our USP standards and improve our continual readiness for our regulatory inspections. Laws and regulations are constantly changing, but we're able to maintain compliance because we can effectively communicate these changes not only with our pharmacy teams, but also with the disciplines that may impact.
At Northwell, we have a central pharmacy. We work with procurement to purchase medications at an advantageous price and then distribute those medications out to our 22 hospitals and infusion centers, providing a financial benefit to those sites and the organization.
My role is negotiating pharmaceutical contracts for the health system, and this helps to keep costs down. I also work on mitigation strategies to mitigate drug shortages. In the United States, there's over 300 a year, so my team is very busy trying to make sure that we don't have any interruptions in our supply.
We also have our warehouse, where we can help to mitigate some of the drug shortages that often affect our industry by strategically purchasing and stocking critical care medications that ensure a steady supply chain to our patients. We're able to provide medications to our Northwell Global Missions program. This team goes out to different parts of the world and supplies medications to communities in need. Some of the areas that we've supplied medications to have been Central and South America, Africa, and also Asia.
And now we'll take a look at our 4 service lines.
I'm Enrico Ligniti, AVP for the Pediatric Pharmacy Service Line. I've been part of Northwell for the past 10 years, and I'm very proud of being part of this institution. Here at Cohen Children's Medical Center, I'm fortunate in having had the opportunity to partner with senior exec hospital leadership in developing a business case for IV robotic technology around domains such as having greater ownership of the outsourcing and sterility of the product in the face of an ever-changing regulatory compliance landscape, the ability to repurpose frontline staff to perform more professionally rewarding assignments, and reducing dependency on outsourcing of IV preparation. We started with technology that would help us batch and gain some efficiencies around the volume that we were beginning to experience. And then with that, we exponentially grew with our inventory management needs. So we moved on to adding on some technology to be able to secure the medications that we were utilizing, and then we incorporated the IV robotic technology that we have now.
Oncology pharmacists, whether in a hospital or ambulatory clinic setting, focus on medication management of cancer patients. They work closely with healthcare teams to prepare and dispense chemotherapy and research medications. They calculate precise doses based on patient-specific factors like cancer type and stage, body surface area, and organ function to optimize patient outcome.
The behavioral health service line is where we get the treatment guidelines out, we get policies and procedures, we make sure that the electronic medical record behaves the way you want it to behave to mimic the treatment guidelines that you're putting out. And you're basically setting the tone on how we should be practicing in behavioral health, how we should be prescribing medications. One of the things that I want people to understand is that it takes a lot of work and a lot of years for us to take away the stigma that comes with mental health. And as a pharmacist, you have a responsibility to help people understand that. The brain is an organ, just like any other organ in our body. And sometimes you do need medication to make it work at its best. Northwell Health has been one of the leaders in the country, actually, to destigmatize mental health.
At the heart of behavioral health pharmacy, our pharmacists chose this specialty to make a real impact on the lives of patients with complex psychiatric conditions. We are deeply involved in understanding our patients' unique needs, providing safe and effective medication therapy. Working with doctors, psychiatrists, nurses, nurse practitioners, and other healthcare professionals, we are committed to optimizing medication therapy and improving patient outcomes every day.
At Northwell Health, we have infectious disease clinical pharmacists at each of our hospitals who specialize in managing infectious diseases and ensuring responsible use of antimicrobials. We also have a system antimicrobial stewardship program committee, which is led by infectious diseases pharmacists and physicians that really unites our field with all our subject matter experts across all of our hospitals to ensure that we enhance infectious diseases related patient care. We also have a unique centralized pharmacist-led tele-antimicrobial stewardship program, which really focuses on extending this level of robust patient care into the evenings, overnights, and weekends so that we can partner with our hospitals to ensure that patients receive the same level of consistent, high-quality care at all hours of the day.
ICU pharmacists collaborate with a large healthcare team to provide safe and effective medication usage. We're looking to always minimize patient side effects as well as optimize outcomes in the high-stakes critical care environment.
Patient education includes a comprehensive medication review where the pharmacist checks for drug interactions, potential allergies, any discrepancies, and the actual counseling process includes an open dialogue between the pharmacist and the patient. The pharmacist utilizes open-ended questions as well as the teach-back method to keep the patient engaged. Patient counseling or patient education is an area where pharmacists can really shine and make an impact because that's the area where we are the experts.
Beds to Beds program is a service Northwell provides where patients get their medications delivered to their bedside before they leave the hospital. Along the way, patients get counseled on their medications by a pharmacist.
Region Care is a part of Northwell Health at Home. Region Care Pharmacy provides home infusion therapy to our patients, preventing hospitalizations or, once they're discharged from the hospital, a variety of medications in the comfort of their home. This helps patients resume normal lifestyles and work activities.
Viva Health Pharmacy is Northwell Health's outpatient pharmacy organization. It consists of retail, specialty and mail pharmacies, ambulatory clinical pharmacy services, 340B, PBM, as well as consulting services. What sets Viva Health Pharmacy apart from other pharmacies is the fact that we were born out of a health system. We understand the patient's health conditions and their treatment plans, which allows us to optimize their medication regimens to get the best outcomes possible.
Our ambulatory pharmacy support service teams are charged with developing innovative programs in partnership with our ambulatory providers to ensure that their needs are met as well as their patients. We help the patients get access to their medications, as well as help them understand how to take their medications both safely and effectively. Our medication access teams focus on getting patients on therapy by providing prior authorization support and helping patients enroll in financial assistance programs, which keep patients on therapy longer. Our clinical pharmacy specialists are charged with educating, monitoring, and managing medications to help our patients get to their therapeutic goals faster. A key part of our approach is to meet the patient where they are. And we do this by offering flexible options such as telehealth encounters. Our patients who either find it difficult to get to a pharmacy or to access care, or those who just find it more convenient to have a virtual option, will get the same level of care that we provide in person in our ambulatory practices.
Northwell Pharmacy Residency Program, we have a rather large system, and we have currently 11 what's called PGY1 or Postgraduate Year 1 programs and 7 Postgraduate Year 2 programs. We have currently about 40 residents in our programs across the health system, and the purpose is to build the next generation of pharmacists, clinical pharmacists that will work to give the best care to our patients. We get literally 1,000 people that will apply to our programs to be able to fill what is those 40 slots. So we really pick the best of the best. And so we use clinical pharmacists today to train the next generation so they can learn how to take care of patients, how to receive them, and how to get to the next level so we can offer the best and quality care to our patients.
We are passionate about the future of pharmacy and the positive impact we can make on the patients' lives and the communities in which they live in. We look forward to continuing this important work together.